From a professional ethics standpoint, the short answer is no. It is not considered ethical or clinically appropriate for a practitioner to instruct an entire social circle to ignore or punish someone for self-harm. Here's how professional ethics codes, clinical guidelines, and standard therapeutic practices view this situation. The principle of non-maleficence, do no harm. Medical and mental health professionals operate under a strict code to do no harm. Punishment. Actively punishing someone for a symptom of mental distress is widely recognized as harmful. It increases feelings of shame, isolation, and worthlessness, which are major drivers of self-harming behavior in the first place. Ignoring. While some structured therapies like DBT advise loved ones not to provide extra attention or reinforcement specifically to the act of self-harm itself, they never advocate for ignoring someone entirely. The difference between not reinforcing and abandonment. There is a vital clinical distinction between managing behavioral reinforcement and forcing isolation. The clinical standard. A practitioner might work with family to ensure self-harm isn't the only time a person receives warmth, love, or deep conversation. This is done so that the behavior isn't inadvertently reinforced as the sole way to get their needs met. The ethical violation. Instructing people to broadly ignore or punish a person crosses the line into emotional neglect and a safety risk. It strips away the individual support system when they're at their most vulnerable. Breach of confidentiality. Practitioners are bound by strict confidentiality laws such as HIPAA in the United States. A practitioner cannot legally or ethically tell everyone in your life anything about your treatment or behaviors without explicit written consent except in acute situations to prevent immediate loss of life. Even then, they would contact emergency services or specific guardians and not a broad social circle. Accountability and next steps. If a licensed professional is genuinely instructing a support network to punish or entirely ostracize a patient, it contradicts established clinical guidelines for treating self-harm, and it may constitute a violation of the Professional License Board's ethical code regarding patient care and safety. Patients have a right to question their treatment.